As the U.S. vaccination program stalls, the Delta variant is spreading fast through the country. Here's what you need to know. The number of new cases of COVID-19 in the U.S. has more than doubled in the last 2 weeks, according to the New York Times COVID tracker, with the Delta variant proving difficult to contain and a divide forming between those who are vaccinated and those who are not. As of July 14th, the 7-day average of daily cases in the country was 26,513, up from 12,540 on June 30th, with a notable hotspot emerging across Kansas, Oklahoma, Missouri, Arkansas, Louisiana, and Mississippi. These are states where vaccination rates are among the lowest in the U.S., with just 35% of people in Mississippi fully vaccinated, compared to 66.5% in Vermont, which has the highest vaccination rate in the country, according to the U.S. Centers for Disease Control and Prevention. The effects of infections are also proving much more dangerous to the unvaccinated. While almost 50% of Americans have been fully vaccinated, Associated Press analysis of U.S. government data showed a 99% of deaths and hospitalizations from COVID in the last month involve those who are unvaccinated. The role of the Delta variant in causing many of these infections is now widely acknowledged. It made up to 57.6% of new infections in the U.S. between June 20th and July 3rd, according to U.S. Centers for Disease Control and Prevention. Delta is defined by several mutations to its spike protein, including at position L452R. Several of these mutations make the body's immune responses less effective, and according to the Global Virus Network, its P681R mutation, directly beside the furin cleavage site, is key in enabling the virus to grip onto and invade human cells more effectively. This increased ability to replicate inside human airways can mean an individual is likely to shed more virus particles when infected, a virologist at Imperial College London told the Daily Telegraph. And the overall outcome of these adjustments to the virus is that the U.S. is currently dealing with a variant that is up to 60% more transmissible than the Alpha variant, according to a modeling study cited by the Global Virus Network. Evidence shows vaccines remain effective against Delta, however. A Public Health England study on vaccine efficacy against the Delta variant found the Pfizer-BioNTech vaccine 96% effective against hospitalization after 2 doses, with AstraZeneca 92% effective. Overall, it found Pfizer-BioNTech just 6% less effective than it is against the Alpha variant, and AstraZeneca just 1% less effective. That scientific reality leaves the race to vaccinate as the key story in the U.S. at this moment, with one professor in the Division of Infectious Diseases at Vanderbilt University Medical Center explaining to CNN that the more unvaccinated people there are, the more opportunities for the virus to multiply and mutate. Vaccination rates within the U.S. have dropped off in recent weeks, with average daily vaccinations falling from a peak of 3.4 million per day to around 417,000 as of July 9th, according to the U.S. Centers for Disease Control and Prevention. Currently, 48.3% of the U.S. population is fully vaccinated. However, there is also room for optimism as a result of the vaccinations administered so far. According to the New York Times COVID tracker, even with the recent spike, new infections in the U.S. are currently less than 1/10 of the average daily rate at the height of the pandemic in January. Hospitalizations represent just a fraction of their winter peak, and deaths are near their lowest level since spring 2020. The U.S. is certainly in a better position than Indonesia, which set a daily case record of 54,517 on Wednesday, according to CNN, with 991 deaths. Similarly, Russia had 25,293 new cases and a record death toll of 791 on Thursday, according to the Moscow Times. While in China, local governments are moving aggressively to push residents to get vaccinated, and some are planning to bar them from accessing public venues if they refuse, according to MarketWatch. As the vaccination push continues, all eyes will be watching how the virus evolves from here, including the Lambda variant. Concerns over the transmissibility and danger posed by the Lambda COVID-19 variant are growing as it has now been detected in 31 countries, according to tracking site GISAID. The variant was first detected in Peru and now accounts for 82% of new infections in the country, according to German broadcaster Deutsche Welle. It is also being detected in 33% of cases in Chile. Other countries in South America, including Argentina and Brazil, are experiencing rapid spreads of their own. The variant is defined by several mutations to its spike protein. The L452Q mutation in particular is believed to have enhanced its ability to attach to human cells, according to a preprint of a study printed on the bioRxiv online archive. The same study showed some increase in resistance to antibodies created by Pfizer-BioNTech and Moderna's vaccines. This was again caused by the L552Q mutation, as well as the 4590S mutation. However, the study concluded that this increased resistance was minor. Much of the concern around the variant then seemingly comes from its effects in the outside world, rather than scientific analysis of its abilities. Peru, where it is dominant, has the highest number of COVID deaths per head of population in the world, and the highest number of deaths per confirmed case of COVID-19. However, other factors could also be involved in these figures. For instance, the BBC reported last month that Peru's health service had several severe weaknesses in its COVID response, and high case numbers could even be attributed to an absence of refrigerators in people's homes, forcing households to make frequent trips to markets. One WHO virologist remained equivocal when discussing the Lambda variant with Deutsche Welle. So far, we have seen no indication that the Lambda variant is more aggressive, he said. It is possible that it may exhibit higher infection rates, but we don't yet have enough reliable data to compare it to Gamma or Delta. For the moment, we can only be clear that this variant is spreading quickly through South America and the world. One researcher at a university in Peru's capital city said, "We had 200 Lambda infections in December. By the end of March, it made up half of all samples taken to Lima. Now, 3 months later, we are looking at more than 80% of all infections nationwide." Lambda has become the dominant variant in Peru in a very short period of time. On a similarly pessimistic note, the same researcher suggested that South America is likely to become a breeding ground for new COVID variants, owing to the combination of overwhelmed healthcare systems, populations working precarious jobs where it's difficult to follow safety precautions, and a lack of vaccines. Chile has vaccinated 60% of its citizens, but that is an exception on the continent, the researcher cited by Deutsche Welle said. It is very likely that new variants will appear during a third wave of coronavirus infections during the South American winter between July and September. They may not be any more lethal, but they will definitely be more communicable. In other words, we could be set for a lot more variants like this one. We can probably all agree that no coronavirus variant is good. However, it does seem that some variants are particularly good at being bad. And one in particular is now being described by WHO officials as the most able and fastest and fittest of all the variants. Here's what you need to know. The Delta variant is becoming the dominant strain of coronavirus worldwide, according to the WHO, and its combination of high transmissibility, high severity, and escape from vaccines makes it very dangerous, experts told National Geographic. The variant has a number of mutations in its spike proteins that can make it harder for antibodies to attach to the virus, or easier for it to latch onto and invade human cells. According to science journal Nature, one mutation in particular is at the furin cleavage site, which is important for the virus's ability to replicate inside human airways. If the virus is better at replicating inside human airways, it can mean an individual is likely to shed more virus particles when infected, a virologist at Imperial College London told the Daily Telegraph. UK Health Secretary Matt Hancock told the BBC this month that the variant was around 40% more transmissible than the Alpha variant. The Alpha variant itself is thought to be between 40 and 70% more transmissible than the original virus strain found in Wuhan, according to studies cited by the Australian Broadcasting Corporation. A Public Health England study on vaccine efficacy against the Delta variant found the Pfizer-BioNTech vaccine 96% effective against hospitalization after 2 doses, with AstraZeneca 92% effective. Overall, it found Pfizer-BioNTech 6% less effective than it is against the Alpha variant, and AstraZeneca 1% less effective. More information is needed to confirm reports the Delta variant causes more severe disease, according to the WHO's COVID technical lead, Maria Van Kerkhove. However, Tim Spector, a researcher with a COVID symptom study, told New Atlas its symptoms were more often headaches and runny noses than coughing or loss of smell, which could result in people not realizing they have COVID. It is also possible to find convincing evidence that this variant causes more severe disease than any other variants. A study published in the Lancet Medical Journal found that people in Scotland infected with the Delta variant were twice as likely to be hospitalized.
For more news animations and explainers, hit the subscribe and bell button to join the TomoNews family. Thanks for watching.